Hello, everyone. Today I'll be presenting the case study Ectopic Pregnancies. My name is Lily Solomon, and today's date is August 13th, 2024. So, this is first a quick definition of ectopic pregnancy. This occurs when fertilization happens outside of the oviduct. It is a very life threatening condition and one that does not support the growth of embryos into fetal life. So, let me go into this more specifically. An ectopic pregnancy occurs when the fertilized egg implants outside of the uterus, as I said. This most commonly happens in the fallopian tubes, but can also occur in the ovary, abdominal cavity, and the cervix. Ectopic pregnancies are not viable because only the uterus can support a pregnancy. If left untreated, the ectopic pregnancy can be life threatening, and it's especially if the fallopian tubes are rupturing, causing severe bleeding, infections, and possible death. It is critical to seek medical attention promptly for ectopic pregnancies. Some symptoms include vaginal bleeding, pain in both the lower abdomen, pelvis, and lower back, and dizziness and weakness. So, how can fertilization occur outside of the oviduct? There's tube damage or blockage, and this damage to the fallopian tubes are due to the infection, surgery, or conditions like pelvic inflammatory disease or PID, and this impairs the movement of the fertilized egg towards the uterus. Scarring or blocking can trap the fertilized egg in the fallopian tube, and this leads to an ectopic pregnancy. There's also slowed tube transport. Certain hormonal balances or dysfunctions in the cilia, which, if you don't know, these are tiny hair like structures lining the fallopian tubes, this can slow down the transport of the fertilized eggs and prevents it from reaching the uterus in time for normal implantation. If the eggs remain in the fallopian tubes for too long, it may implant there. Tube constriction or spasms are also how the fertilization can occur. Muscle contractions in the fallopian tubes help move the eggs towards the uterus. If these contractions are abnormal, either due to spasms or constrictions, the egg may not move properly, leading to implantation within the tube. There's also assistive reproductive techniques. Sometimes fertility treatment like IVS, or also known as in vitro fertilization, can result in the implantation of embryos outside of the uterus, although this is very rare, so I wouldn't worry about this too much. And then there's abdominal variations. Sometimes there's abnormalities in the structures of the fallopian tubes or reproductive tract that can predispose a woman to an ectopic pregnancy. Also, did you know that ectopic pregnancies also occur in 2% of all pregnancies? So this is extremely rare. My next question is, what kinds of hormonal complications would you expect in this situation? First, the progesterone levels would be lower than expected. The corpus luteum, which produces progesterone, may not function properly due to abnormal signaling from the ectopic pregnancy. If the ectopic pregnancy ruptures, it can lead to severe internal bleeding, potentially causing a shock response. And this crisis may involve a surge in stress, hormones like cortisol, and adrenaline. The presence of HCG in blood or urine may give false positive results, leading to confusion and early pregnancy diagnosis. After treatment for an ectopic pregnancy, whether through surgery, medication like methotrexate, and I will discuss that in a second, a woman may experience hormonal fluctuation as her body adjusts. So, why is this a life threatening condition? The first thing I'd like to talk about is the risk of rupture. The most dangerous aspect of ectopic pregnancy is the potential for ruptures. Since the fertilized egg implants outside of the uterus, most commonly in the fallopian tubes, as I said, the tissues in this area is not designed to accommodate a growing embryo. As the pregnancy progresses, the tissues can stretch beyond its capacity, and this leads to a rupture. There's also severe internal bleeding. If the ectopic pregnancy ruptures, it can cause severe internal bleeding, or also known as hemorrhages. The fallopian tube and other areas where ectopic pregnancy commonly occur have a rich blood supply. A rupture like this can lead to a rapid, significant blood loss in the abdominal cavity, and this is extremely life-threatening if it's not treated properly. The next is a hemorrhagic shock. I'm sorry if I'm saying this wrong. The massive internal bleeding can lead to hemorrhagic shock and a condition where the body's organs do not get enough blood due to the significant loss of blood volume. This can cause a drop in blood pressure, a rapid heart rate, and ultimately organ failure if this is not managed quickly. There's also delay in diagnosis. Ectopic pregnancies can sometimes be difficult to diagnose early, especially if the symptoms are mild or mistaken for other conditions. This delay can allow the pregnancy to progress to a more dangerous stage, and this increases the risk of rupture and complication. So, to summarize, there's risk of rupture, severe internal bleeding, hemorrhagic shock, and delay in diagnosis. My final question about this case study of ectopic pregnancy is, how is it treated and what are the possible consequences of that treatment? I'm going to list two of the treatments that I've found, and I'm sorry if I pronounced this wrong. The first treatment is methotrexate. This is for ectopic pregnancies, which means it stops the fertilized egg from growing and ends the pregnancy using medication. The consequences can be listed of side effects including abdominal pain, nausea, vomiting, and fatigue. There's also incomplete resolution. In some cases, the ectopic pregnancy may not completely resolve with medication, and this requires additional doses or surgical interventions. The impact on future fertility is also affected by methotrexate because it does not affect future fertility, but there may be some delay in trying to conceive again. This is due a lot of mental health reasons and psychologically can be extremely difficult for a woman to try to conceive again because they may be worried that this could happen again and it could have been traumatic the first time with their ectopic pregnancy. The second treatment is surgery for ectopic pregnancy. When one wants to remove the ectopic pregnancy, it needs to be extremely quick of risk of rupture, and it may lead to surgeons removing the entire fallopian tubes. The first consequence is risk of surgery, which is very generalized. Like any other surgery, it can lead to infections, bleeding, and a reaction to the anesthesia. There's also a loss of a fallopian tube. If a fallopian tube is severely damaged or ruptured, it may need to be removed, which could reduce fertility by decreasing the chances of natural conception. So, either one of the fallopian tubes can be removed, which could still have the chance of a pregnancy, but a lot of the time, both could be removed if you've had multiple ectopic pregnancies because they don't want this to happen again because it is so life-threatening, as I said in the slides before. Finally, there is a psychological impact. The loss of pregnancy, especially in an emergency surgical context, can lead to emotional and psychological stress. This includes grief and anxiety about future pregnancies. So, for both of the treatments, and no matter what happens with an ectopic pregnancy or any type of pregnancy that leads into any removal, it can be extremely uncomfortable for the women. It can be extremely anxious. There is grief because that woman may have thought that they were going to have a baby and they have to be disappointed if they were hoping for it. So the psychological impact is extremely, I think it's one of the most important things to talk about, how the emotions of a woman can really be affected. Thank you so much for listening, and I hope you all learned something new about ectopic pregnancies. Once again, my name is Lily Solomon, and thank you for listening.